If I were speaking to a dentist who was concerned about taking on patients with developmental disabilities or special needs, I would tell them to fear not, because there are so many resources available. ABLE New Hampshire, New Hampshire Council on Developmental Disabilities, your area agency. We're so fortunate in New Hampshire to have so many resources available.
There will be a significant increase in the number of patients that will be taking advantage of this program. We're going to have to evolve. Dentistry will have to evolve to meet their specific needs. When our charge is helping patients and helping people find that dental home and having that continuum of care, it's worth the effort. We want to make sure that this thing works. In New Hampshire Dental Society, we have a Dental Medicaid Advisory Committee that continuously looks at the information and provides whatever resources come out for our members, and non-members as well.
I never got anybody that really asked a lot of questions or wanted to, know how they could modify things to accommodate her. I feel like there needs to be some education or more awareness of special needs. And more willingness to, ask about, well, what will make this successful?
It takes a lot for a patient to walk through that door sometimes at a dental facility. You never know somebody's story behind the scenes, what they've gone through in their past life, what's brought them to the situation where they rely on Medicaid to help them. So we never want to judge anybody.
Don't be afraid of working with new patients. I think if the dentist would offer sunglasses for the century of the too bright of lights, ask them specific questions, and if you are in a wheelchair, make sure you can get through the front door. Can you get into the examining room? Can you get on the table, or can you be worked on from your wheelchair, just like in a reclining position, things like that.
We have music that plays. We have a TV that, we can ask them what their favorite station is while they're getting their teeth cleaned. The first visit, we always want to make them feel comfortable and saying, okay, it really wasn't that bad.
If I look at my daughter, she has a lot of sensory issues with her mouth. She needs sensory input. But what's really interesting is when we go to this practice, Katie is just another part of the gang. She's just another kid. They've got it down because we had those conversations early on, and maybe they don't have expertise in Down syndrome when they started, but they do now.
It's a team effort. It's not just the dentist, not just the hygienist, it's the front desk, it's the assistant. It's a family, it's a dynamic that can really make this successful. And when somebody has a dental home, they can build those relationships, consistency in care, seeing the same hygienist, seeing the same dentist, you know what to expect.